recording. I'll start recording now. I'll put the corrected files in Easy Class, yeah, and I'll save this as a video, and I'll post it on YouTube in a bit. Okay, so I'll turn this off. I'll do a screen share. Let me just get this letter over here. And okay, can you see this now? I'll just make it a little bigger. Bigger, 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 bigger. Right, can you see this then? Yeah. Is that a yes? Can you see it? Yeah, yeah, very good. Let me know. Okay. So I just sort this desktop out. Right. Don't need that. Let's get on. So I'll save the changes. I'll put these files in Easy Class afterwards for those who want to have a look at them. If you're not a member of Easy Class, it's quite easy to join. If you're taking the exam this weekend, there's probably not too much point, but if you're taking it in the future, it could be useful for you. So, Mrs. Potter, what do we have to do? So first things first, as always, we go to the task. Very first thing, go to the task, look at the language that we need, and that will inform us what we need to do. So a letter of referral, surgical consultation. Okay. So Mrs. Potter is 70, worsening arthritis, pain in the knee, yeah, pain on walking, pressure. So it looks like she may well need a knee joint replacement. Okay. Now, for this kind of a letter, you know, you have to decide what's going to come after the, well, it's not an introduction, well, it's kind of an introduction. It's the reason for writing. Why are you writing this? And for the reader, why am I wasting my time reading this? I want to know. So the reason for writing, that should be the first thing. I'm writing to request, I'm writing to refer to you, etc. Yeah. Then, is it going to be the social or medical history or the main medical issue? Well, I've got a feeling we're telling a story here, so we might have to show a chronology of how things have developed over time that will lead to us asking for a consultation for possible knee joint replacement. So let's have a look. I'm writing to refer Mrs. Potter for what? Who's writing on the screen? Don't write on the screen. I'm writing to refer Mrs. Potter for what? For what are you referring her? Ah, good, right. Take that off. Refer Mrs. Potter for what? Okay. Who presented with clinical features suggestive of worsening osteoarthritis. So what are you referring her for? Why are you writing to me? Are you planning on telling me? Oh, I've got to wait right till the bottom before I find out what it is that you want me to do. As a general idea, I would put it in the introduction. Reason, I'm writing to you because I want you to do something, and I'm going to lay things out and show you why I think you should. I don't like having to read all the way down, have to guess, oh, you might want me to perform an operation. Well, why didn't you tell me that right from the start? Okay. Past medical history, significant for osteoarthritis, last 10 years. Hypertension, skin cancer, do we need that? Not as such. That's not really informing us of the story. Medications, okay, only fats are significant. Okay, Mrs. Potter initially presented 1 year history of increasing pain in the left knee, which have now, which have. So knee is singular or plural? Pain, is it singular or plural? Anybody? Which have now, which has now become worse. On examination, there was no joint swelling, witness, or sign of injury to anything. Joint for Marva was slight tenderness. So I would always tend to use an called a slight tenderness and pressure and reduced range of movement, or a reduced range of movement in left knee. Therefore, tablets, naproxen, well, we don't really need that, because you wouldn't put tablets as an adjective anyway. It's a noun, you know. Doctors and restorative required X-ray and blood investigations were ordered. On review today, the blood reports were normal with the X-ray report the joints. I have arranged an appointment with physiotherapist and to increase the dose of analgesics. That's good. Basically, both mentioned clinical findings. That's good. Therefore, referring to, well, no, you're not referring to. You would refer her to you, but you don't need your preposition there. To your care for menopause. Right, so that's good. But why do I have to read all the way down here until I find out what you want me to do? You should have put that in the introduction. Surgical consultation, yeah? So put it here as well as at the end, okay? But apart from that, excuse me, the grammar's not too bad. So have instead of has, get your subject verb, agree, article, and we don't need that preposition there, okay? So who wrote that? Dr. Rabia. Is he or she here? Are they here? Do they have any questions about that? Does anybody have any questions before I move on? Anybody got any questions? You can either type your question or you can raise your hand and I'll turn your microphone on and you can ask. Anybody? No? Okay then. Moving on. Let's get on. Number 2. Okay. I'm writing to request your surgical opinion regarding joint knee replacement. Okay, I think we need something here. We need some kind of articulage. Let's have a look. So I'm writing to request your surgical opinion regarding possible joint knee replacement for Mrs. Potter, because you will be doing it for her, whose features are consistent with worsening osteoarthritis. Okay, that's good. Initially, Mrs. Potter presented on the 23rd of a second, blah, 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 complaining severe pain in left knee. For the previous, no, right. This reads that she was complaining, but she's been complaining for 12 months. She's complaining that she had pain, or that she has had, complaining of having had severe pain in the left knee for the previous 12 months, which was not really by painkillers. She also reported that pain occurs at rest after exertion. Okay, that's good. Upon examination, due to pain, Mrs. Potter's range of movement was limited and there was a tenderness along the joints. Therefore, I arranged an X-ray, a smoke test in order to rule out the diagnosis. What diagnosis? What diagnosis are you trying to rule out? Did you mention a diagnosis? You don't mention it here. You just say she came, she reported pain to rule out a diagnosis. Well, that doesn't make sense because you haven't made one yet. So that needs to be rephrased. On today's review, Mrs. Potter for test results. This, okay, going with a surgical consultation and possibly a joint knee replacement. That's pretty good, pretty good. So the only thing that's, well, as you see, that I would change here is stick an article here, right? A consultation and possibly a joint knee replacement. I'm not quite sure what that particular part means, but here I would have put, what's that? Present perfect continuous, having had a severe pain. So that makes it clear as to what is going on. Okay, so not, but apart from that, oh yes, and of course, so possible joint knee replacement. So that's not so bad. That's not so bad at all. As a matter of fact, there's some very good language there. There's some pretty good language there. That's pretty good indeed. Okay, let's move on. Which number 2? Why does it say 4? Oh, number 3 seems to be missing. I don't know. We've got 1, 2, and no 3, just a 4. Oh, okay. Dr. Ahmed, let's have a look, see what we've got. So, Mrs. Carol Potter, okay, writing to request your further assessment and management of the operation, Mrs. Potter. With the, right, well, it's not, right, no. Okay, I would use a definite article here. Can anybody tell me why? If you can, I'll give you a prize. Can anybody, well, I won't, but can anybody tell me why I would put a definite article, why I would remove this indefinite A and put a definite the possibility? Why would I do that? This should be a good test. Can somebody tell me? Yes, because it's a specific request. Excellent. Very good. That's the reason why. So, of a left knee joint replacement operation for Mrs. Potter, because you're not replacing her, for Mrs. Potter, whose clinical features are consistent with worsening osteoarthritis. Excellent. Mrs. Potter presented 1 week history of increased pains, which were walking, spent on painkillers. Her condition had not improved. Okay, past perfect. That's not bad. Okay, on examination, there were restricted movements on left knee joint, tenderness on pressure, an X-ray is going to be on the next day, or for the next day is better than on. On review today, Mrs. Potter's ailments have remained unchanged. Well, I said, well, yeah. 1 day later, I suppose, her arthritis wouldn't have disappeared in the space of 24 hours. But okay, but anyway, good use of vocabulary though. That's a good word. Ailments have remained unchanged. X-rays have shown osteophytes, loss of joint space in the left knee. On review today, its results show. Now, it's tricky. Because right, you're writing this letter, yeah. So the consultation was earlier in the day, so it's in the past. But present perfect is an indefinite time. So I would use her and her X-ray results show. Now, show, because I'm writing this letter now, I've got the X-ray results in my hand. So I know I looked at the X-ray results when she came in previously, so it's in the past, but it's the same day, yeah? And you could well be looking at these X-ray results while you are writing this. And it's show today, and also today's not finished. So I would make it present and simple. That's why I would do that. However, there were no signs of fractures, no just remarkable in terms of past medical history or her past medical history. Has been, that's good, present perfect continuous. Using adverb since, very good. Known case hypertension, weakness, insomnia. Okay, in view of the above, if you conduct, so why is this a conditional step? What? If you conduct what? So that's not, so if you're using if, it implies it's a conditional sentence, but what's the second part? So in view of the above, I request or I would appreciate it if you could. In view of the above, I would appreciate it if you could conduct an evaluation and treatment of this patient with a possible, because a here is singular, yeah, with a possible left knee joint replacement. So this is more like a conditional structure now, okay? Because the way that was written before didn't quite work, but now, in view of the above, I would appreciate it if you could conduct an evaluation treatment of this patient with a possible left knee joint replacement. If you have any queries, blah, 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 please don't hesitate to contact me. So that's not bad at all. You see, I only made a couple of changes there. So that's quite good. Now, Sam's got a question, which is better, past medical history at the end or at the beginning? I say it depends entirely on the circumstances. Sorry, every letter is different. For some of them, it would be important to put the past history right at the start so we can see how the picture develops. In some, it's not important, you know. It's up to you. Every letter is different. As long as you have a logical flow to your letter, be fine. Someone else asks, can we write X-ray findings in the simple past? Well, you under X-ray results, you could have put showed, but as I said, it's kind of tricky. It doesn't make a lot of difference here because, right, you're writing on the same day, right? So the day ostensibly has not finished. So although she came in sometime in the day and you're writing this letter on the same day, because of a lapse of time might not be so far back, you could use her X-ray results show, as in I'm looking at her X-ray results now, they're in my hand and they show me now this. You could use the simple past of X-ray results showed. You could use that too. Again, we don't really know the context, and either of those would be fine. X-ray or X-ray, which one is correct? Doesn't matter if you have a capital X or not. It's irrelevant, not important that. So there's a few things there that you can see. Okay, so what time is it? 9:23. Okay, I've got a bit of time left. So let me just get on. Now, Joseph sent another letter. Let me find it. What did you send? There's like 2 new second lots. Let me just get this open. I'll close that and we'll take a look at the second one because there's only 2 letters here and we should better get these done, but I've got to get off. Got some students coming, so okay, there's 2 here. Okay, so let's have a look at these then. I'll do a screen share. We'll take a look at these. Okay. Right. Can you see this now? Yeah. This is the second letter. Well, the second part of letter. So who do we have here? Dr. Mers and somebody else. Oh, that's not formatted well. I don't know what's happened there. That's not formatted very well. What's happened there? Something wrong with that. Let's see if I can fix it. Ah, that's better. Okay. Right, let's have a look. I'm writing to refer Mrs. Potter for what and to whom? Well, presumably to the reader, but for what exactly are you referring her? What are you referring her to me for? Have I got to wait and find out before you'll tell me? Maybe I do. Do you tell me at the end? Now, okay, right. If you could assess the, now look, right, we've got a definite article here in front of this. Now, what do you usually do? When you introduce something for the first time, you use an indefinite article, yeah? So if you'd mentioned knee joint replacement here at the start, a possible knee joint replacement, then having a definite article in front of it here would be fine because it would be the second mention, yeah? So that's what I would do. Mrs. Potter, a retired woman. Well, we don't actually need this. If you'd have put the DOB, we would have seen that she's over 70. And then we could have not used that. Just whose features are consistent. Anyway, regarding her medical history, diagnosed osteoarthritis, which is Pandol osteo, by Ramapril. Okay, she presented yesterday. Okay. Now, you can say she, but usually I would put the name of the patient first. So in your paragraph, I put the name of the patient for the first usage, then she, her, etc. Yeah, I think that's better. Bit more formal. Mrs. Potter presented yesterday. Complained. What's this? Complained. Shouldn't it be continuous verb? Complaining. So she presented yesterday complaining that the pain in the left knee had been deteriorating. Right. Pain. Now, in strict terms, if your pain is deteriorating, it means it's getting worse. But it's so I would have said something like and had been deteriorating. Let's have a look at this again. Medical history. So osteoarthritis, hands on these. Okay. Complaining that the pain. Now, right. Now, so again, right, we've got a definite article, yeah, and usually we use a definite article when we've introduced something at first. We use indefinite. Then, when we know what pain or what thing we're talking about, then we can use a definite article. But you're using this here, but you haven't said anything about her pain. You know, so it's like you should have said something like the previous ones, like she presented and put the date, complaining of a long-standing pain in her knee, which had been getting worse, etc. Here, this assumes that we know what pain you're talking about, and we don't. You've not introduced it yet. Yeah? If you see, you've not introduced this pain yet. So now you're saying the pain, but what pain? You haven't introduced it yet. So that needs a bit of changing. Being deteriorating and had not alleviated. Well, if that is passive, it should be had not been. Oops. had not been alleviated by the painkiller, what painkiller are you talking about? So painkillers in general. So again, we don't need a definite article there. The examination of tenderness in his left knee. His? Okay. Associated with reduced motion, swelling of severe papers in the right knee, according to the book tests were other than she was commenced. Okay. So why have you mixed these? His, she, okay. On today's review of the blood test looks remarkable, detected left X-ray on yes. It would be appreciated if you could assess and measure and manage her condition. Okay, well, again, as I say, so you've done this a couple of times now. You've introduced something which you haven't previously introduced. You know, I mean, this is the first time that we read anything about knee joint. Oh, you want me to replace her knee joint? Why didn't you say that earlier? You know, and the pain, the particular pain, why didn't you mention that first? Yeah. So this is not as clear as it could be. Okay. It's not bad, but it's not as clear as it could be. I would try and work on the order of events a little better, I think. If you look at the previous letters, you'll see exactly what I'm talking about, where they introduce it first. She presented complaining of having a long-standing pain, blah, 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 blah. Then the pain was not alleviated. Instead of just presuming that we know what you're talking about, you've got to introduce it first to maintain a logical flow. Dr. Mustafa, let's have a look. Writing to refer Mrs. Potter's diagnosed osteoarthritis, left knee for consultation. I put a comma there. Your consultation and a possibility of knee joint replacement. Okay, so you can see here in this introduction here, we know what you are referring her for. Instead of I'm writing to refer Mrs. Potter, I'm not saying what you are referring her for or to. Here, we know exactly. You want me to have a look and maybe replace her knee. Okay, that's good. Mrs. Potter's, don't forget we want a possessive, Mrs. Potter's medical history. She has been suffering. That's good. Present perfect continuous. Using since. Very good. That's good. Apart from not including a possessive, that's a pretty good paragraph. Okay. Presents my practice with a 12 months history of left knee pain, which was increased by walking, not really by medication. Now, you see what I'm talking about. So you introduce it at first, right? She's had a long-standing pain. The pain now has increased, yeah? So that's good. Was tenderness, you could say tenderness in general, a tenderness, if it's one particular spot, it doesn't matter. There's no need for these two short sentences. You could conjoin those with a conjunction, you know, and etc. You know, so we don't really need those two very short sentences. Okay, on view today, Mrs. Potter's X-ray showed. Why did you use a possessive form here, but you didn't use a possessive form there? It's the same thing. Okay, Mrs. Potter's X-ray showed the joint. Also joint miss, however, no Johnson writing to ask for your opinion regarding the possibility of a knee joint. Again, you could say knee joint replacement in general, or you could make it a singular. It doesn't actually change anything. So that's pretty good. That's pretty good. Dr. Mustafa, pretty good. Barely changed anything there. Excellent, excellent, excellent work. Right, well, I'm going to save these files now, and I'll put them in the library in Easy Class. Now, does anybody have any questions? I've got a bit of time left before I've got to go, because I've got students coming soon, and I've got to prepare for those. Now, you can either put your hand up, or you can type your question. We'll just check what we're doing here. Okay. You've got a question. Well, why don't you ask it then? Can we write the diagnosis in reference line? Well, you could do, yeah. If it were short and to the point, you could do. Nothing to stop you there. Somebody wants, what's the name of my channel? It's called English Right Now. I'll send you a link to it now, because I'll be putting this up on YouTube in a minute once I've got it done. Let me just find you a link to my channel. You can have a look. Yeah, I'll put this video. Okay, there we go. So, what else? I've got some other questions. Is it correct to say pain in the left knee joint, which has been, or had been? I would use had been, because that is past perfect, which means it's finished. Has been present is better because it hasn't finished. It's connecting past and present. It's ongoing. If you used had been past perfect, it means it's finished. Has been having symptoms of osteoarthritis for the past 10 years. Yeah, well, I suppose it is. But they did say something about osteoarthritis in 2008. So, which is fine. But yeah, in the last one, Dr. Mustafa said she has been suffering from osteoarthritis since 2008. So, yeah. He used present perfect continuous to show how long she's had this. Somebody said something about it necessary the paragraph to contain at least 2 sentences. Oh, it doesn't matter. It's irrelevant. Don't be concerned about very minor points which will have zero or virtually zero effect on your score. Most important thing is, do you fulfill the task, right? Do you include all the relevant information? Is the letter, does it have a logical flow? Is it clear to the reader what you want them to do? Do you construct a narrative that shows, I want you to do this because this. So you can see why I want, this. That's the most important thing. It's about the task. Communicative effectiveness. It's an English test, and one of the criteria of an advanced user of English, or indeed of any language, is the ability to logically and systematically conduct or defend an argument. Now, this is not an argument as such, but an argument in the sense that you are constructing a logical position. I want you to assess this patient because this leads to this, therefore. So it's basically saying, so, your grammar, your vocab, your punctuation are important, but the most important, and, the examiners go to task achievement first. That's the first thing. Do you do what they ask you? Do you write to this person and say, I want this? Do you make the sentences long? Is it in note form, etc.? If you do that, that's a big help. Okay, that should be it then. So I'll put the letters, I'm going to save them now, and I'll put them in Easy Class, and I'll put this on YouTube, and I'll put the link in Telegram. So I'll see you later, and good luck for this weekend.